Hello everybody, my name is Luciano and I will present this trial comparing underwater and conventional techniques for the resection of colorectal lesions. I'd like to thank you, the editorial board, for having accepted our study and for the opportunity to explain it in detail during this interview as well. First of all, let me introduce myself. Recently, I finished my postdoctorate exactly with this research in the University of São Paulo. Currently, I am endoscopist at Fleury Medicina e Saúde, one of the largest diagnostic medicine companies in Brazil. And I'm working as an attending physician at the Cancer Institute of the São Paulo, where this study was performed. The first question of any study is why? So let me tell you a terrible experience that happened to me 12 years ago. During a conventional EMR, a patient of mine had a perforation on Christmas Eve. After this, I tried to learn a lesson. Then I went deep into the subject. I tried to improve my skills and also studied a lot about it. And I concluded that, albeit a safe method, conventional EMR is still associated with a small but not insignificant risk of adverse events, even in the most experienced hands. Furthermore, even though it is considered an effective technique, a major concern of the conventional EMR is the risk of recurrence. To address these limitations, Müller conceived an alternative technique to remove the lesion without submucosal injection, the underwater EMR. I talked to some colleagues who already used this technique, and they were very enthusiastic. At the same time, I was hired by the Cancer Institute. And just in the first month, Professor Foz, the head of endoscopy service, suggested me to do this randomized study comparing the conventional technique and the underwater one. However, I and many of our service had never performed an underwater resection before. So I proposed to do a pilot study, then we could familiarize ourselves with this procedure. This initial experience with UMR was published previously. After this, we started including patients in the randomized trial. From 2017 to 2021, 105 patients were enrolled, with 120 naive, sessile, or flat colorectal lesions measuring between 10 and 40 millimeters in size. 53 patients with 61 lesions were randomly allocated to the UMR group, and 52 patients with 59 lesions to the conventional one. No statistical differences were observed in demographic characteristics or histology. Additional coagulations were needed after 2 resections, 1 per group, and were considered failures. Then, both methods were very effective. In block resection rates were also similar. Intra-procedure bleeding was mainly related to conventional EMR, but without statistical significance. there were no cases of late bleeding or perforations. Follow-up colonoscopies were performed in 93 patients who had previously 103 lesions. Overall recurrence rate was 8.7%. Recurrence was higher in conventional EMR than in the underwater group, with statistical significance. Therefore, the relative risk of 6-month recurrence rate was 7.5-fold higher in the conventional EMR. In conclusion, this randomized study demonstrated that both UMR and conventional EMR are effective and have similar rates of adverse events. In our study, underwater EMR technique was associated with lower recurrence rate. However, more trials with higher number of patients and longer follow-up are needed to confirm this observation. To finish, I would like to invite everybody to download the full version of this article, as well as send me comments and questions. I also would like to invite everyone to visit Brazil and the Cancer Institute, our hospital. And I would like to say again my thanks for the opportunity to participate to this GIE interview series.